what happens to your body if your blood cholesterol becomes too high. Yes, this is the topic of discussion in today's lecture. Cholesterol is important for our body, there is no doubt. It is required for our body. But if it becomes too high in your blood, then it causes so many problems. What happens if cholesterol becomes too high? Cholesterol means it is a kind of fat. You know this thing. So when blood cholesterol becomes too high, then in that case, there is a possibility of deposition of fats or cholesterol on the inner linings of arteries. And you know that arteries carry oxygen and nutrients with it to the different parts of our body, such as brain, heart, kidneys, limbs. Okay, so if fat deposition is there, this is also called plaque, or the disease related to this is called atherosclerosis. Okay, so in that case, that deposition narrows the artery. Narrows means what? The area through which the blood was flowing, that is narrowed. So available area to pass the blood becomes smaller than previous one. Okay, so this causes problem. That means blood to the required organ is reaching in less amount. That means the amount of oxygen and the amount of nutrients reaching to the organs becoming less, with the deposition of fats inside the on the inner linings of the arteries. So now if you talk about coronary arteries means these arteries carry the blood to the heart. Okay, so if there is deposition of cholesterol due to the presence of high cholesterol level in your blood, there is a possibility of deposition of fats on the inner linings of the coronary arteries. So in such cases, what happens? The blood flowing to the or reaching to the heart muscle becomes lower. So in such case, there is a chance or there is a possibility of damage to the muscles of the heart. And if plaque ruptures, means if a blood clot forms and if completely stops the blood flow to the heart, then there is a chance of heart attack. And you know that heart attack is severe. So this is the risk involved with high blood cholesterol. So I was talking about heart. Then comes brain. You know that carotid artery. This carries blood to our brain. So if in that case there is a rupture of the plaques, or if there is a deposition of fat inside the arteries, carotid arteries, then amount of blood reaching to our brain is reduced. Okay, and if it is reduced, that means there is a problem. Our brain damages that way. And if completely stops, if the blood flow completely stops due to the formation of blood clots, means if plaques rupture, okay, means plaques break off, in that case there is a chance of blood clotting. So in such case, there is a possibility of stroke. Yes, various symptoms are there, such as numbness of one side of our body. That is one symptom. So many symptoms are there. Okay, but we know, we are familiar with the terms heart attack, stroke. Okay, and we know that all these things are severe. Again, the few arteries are there which carry blood to our limbs. Especially I am talking about the legs. Okay, so in such cases there is a problem. In case of heart attack and stroke, you may feel chest pain, difficulty in breathing, nausea. In case of legs, if blood flow is reduced to our legs, okay, these are limbs, okay. So in such case, in extreme case, there may be a requirement of amputation of your limbs. Okay, that is the extreme case. Yes, amputation may be required. But if it is less than that, then so many problems you may face. If renal arteries are there, renal arteries carry the blood to our kidneys, and you know that kidney acts as a filter. It filters out waste from the blood. So if your kidneys are damaged, then what will be the result? There will be accumulation of waste product in your body. Okay, so if renal arteries are blocked due to the formation of blood clot, and which is the result of high blood cholesterol, okay, you know that there are two types of cholesterol, LDL and HDL. HDL is called good cholesterol, LDL is called bad cholesterol. Again, triglyceride is there. That is another kind of cholesterol that is also bad for our body. There is a limit. Okay, if you cross that limit, not you, means in your blood, if cholesterol levels I am talking about triglyceride and LDL, if those things cross the prescribed limit, then in that case, problems are there. You may suffer from many problems. Anyway, medications are available, but in all the cases, if you want to go for medications, then you should consult a healthcare provider. Only under the guidance of a healthcare provider, you should take medications. Okay? Your friend is taking that medicine for high cholesterol level, so that's why you will do the same thing. No, that way you should not proceed. Okay? Medications for anything should always be taken under the guidance of healthcare providers. Anyway, it is known to you, and there are certain changes you can modify all those things. Okay, then that will be good for you, means that can reduce the blood cholesterol level, such as dietary changes, trying to consume less cholesterol enriched products. Okay, means you should avoid products which contain, or foods which contain cholesterol or trans fats. Okay, you should avoid all those things. You should increase the consumption of fruits, vegetables, like these things. Okay, and if you are consuming chicken, then in that case you should avoid eating thighs and drumsticks. Drumsticks means it is a part of leg below the knee. That part of the leg is known as drumsticks. I am talking about chicken. Okay, because thighs and the drumsticks, these two parts contain more cholesterol as compared to the breast piece. Breast piece contains low level of cholesterol. So that is safe for you if you are already suffering from high blood cholesterol. Then in case of mutton, means I am talking about goat meat. So in that case, you should avoid shoulder pieces, you should avoid ribs pieces. Safe for you is leg and loin pieces for mutton. You should go for physical exercises at least 150 minutes per week. That means per day, if you calculate this, 150 divided by 7 is equal to 21.4 minutes. So at least per day, you should go for physical exercises for half an hour. 21.4 minutes means half an hour almost. Okay. So this can help you reducing your blood cholesterol levels. You should quit smoking. You should reduce taking alcohol, means amount of alcohol. It is suggested by the doctors that you should reduce the amount of alcohol taken by you. For women it is 1 alcoholic drink per day, and for men it is 2 alcoholic drink per day. This is the prescribed limit. You should not go beyond that. Okay. You should take care of your weight. You should not be overweight. If you are gaining weight, then in that case you have to take care of that thing also. So many ways are there to take care of your high blood cholesterol level. Okay. Anyway, so this was all about the question. Question was, if your blood sugar, I'm not talking about sugar, blood cholesterol. If your blood cholesterol level becomes too high, in that case, what you should do? And what are the problems which you may suffer? So problems are stroke, problems are heart attack, problems are kidney damage, problems are amputation of your limbs. These all problems are severe. These are really fatal. Anyway, so this was all about today's lecture. Okay, means today's topic. Thank you for watching this video.